Great. Well, I see that we're rolling around to 12 o'clock here. I want to join all of you who are joining us here on Zoom as a participant and those joining us on Facebook Live as well. Thank you all for being here. We really look forward to hearing your questions and to having a great discussion with the Health District. Welcome to the Public Health Q&A session hosted by the Wenatchee Valley Museum and Cultural Center. I'm Kristen Lodge, the Director of Development and Communications. Our mission at the museum is to engage and educate in the Wenatchee Valley community, and our museum serves as a community forum, a place where you can meet with your neighbors, learn about issues important to our community, and discuss your thoughts and opinions. While we're not able to gather at our museum right now, we are enjoying the opportunity to gather virtually in forums like this until we can be back together in person. Our goal today is to provide our community with the opportunity to discuss public health and safety during COVID-19, and to get your questions answered about this new virus. Because this virus has had such a dramatic effect on our economy, we also want to discuss public health as it relates to economic recovery during COVID-19, as well as Chelan and Douglas County's phased reopening, spread demographics, healthcare capacity, community mitigation, testing availability, contact tracing, masking, social distancing, and public health resources. Leading the conversation is Dr. Malcolm Butler, Health Officer with the Chelan-Douglas Health District. In addition to his role at the Health District, Dr. Butler is a board-certified family physician who's practiced in Wenatchee for nearly 30 years. He's served as the Medical Director of Columbia Valley Community Health since 1995 and is currently their Chief Medical Officer. Thank you for joining us today, Dr. Butler.
Good to be here. Well, are you done? You ready for me?
I'll switch it over to you in just a second. I just wanted to tell guests that I'll be on hand here today to moderate today's session. We've been crowdsourcing questions over the past few weeks, and we encourage those of you who are joining us today live on Zoom and Facebook to join our discussion. If you're on Facebook Live, feel free to leave a question in the comments, or if you're joining us via Zoom, you can ask a question using Q&A and chat. I'll monitor your questions and do my very best to make sure they get answered. I'd like to invite Dr. Butler the opportunity to share some information with you first, and then we'll open it up to your questions. Dr. Butler, thanks again for being here.
All right, excellent. Thank you, Kristen. Thanks for the nice introduction. Good afternoon, everybody. As Kristen mentioned, I'm Malcolm Butler. I'm actually a board-certified family physician and was asked to assume the role of health officer back in April. And it has been, well, I've been telling a lot of people we are blessed to live in interesting times, and we are certainly living in interesting times. So I have put together a brief slideshow with some of the most recent data we have available to us. As always with COVID-19, everything is in flux. Hopefully this will take me 15 minutes to get through, and after that we'll have time for questions and answers. So Kristen, if you can pull up the slide share or the screen share. Tell me when you guys can see my screen. Do I need to do it on my end, do you think, Kristen?
Either. We can pull it up on our end or on yours.
Okay, because we had it set up once and I guess it was taken down. So let me do that. And then we will run it. Does that look right?
Looks great, thank you.
Okay, here we go. And so hopefully I can just do this and it'll advance. All right, so these are the takeaways that I'm hoping to leave you with after looking at the data. It's important to recognize that as of today, we are now in the second wave. I think we heard a lot about a potential second wave. Well, we are there and this is what it feels like. Reopening the economy when we went to what we called phase 1.9 has increased the incidence, but not the morbidity. So incidents are the number of cases we discover. And that's slightly different from prevalence. Prevalence is looking at the entire iceberg, and how much of the iceberg is underwater is unknown to us. But if we could magically know every single person in Wenatchee who was currently infected with COVID-19, that would be the prevalence. The incidence is just the tip of the iceberg that we can see above the water. It's the number of cases that we are aware of. So we are aware that incidence has increased, but morbidity has not. What is morbidity? Morbidity is the illness associated with the infection. As I'm going to tell you, a lot of people have this infection and don't feel sick. But the people who do get quite sick, and especially those that end up in the hospital or very sick in the ICU, happily that number has not increased. I'm going to show you that most of the disease is in young people who tolerate it well. The medically vulnerable, so those are folks who we know to be at high risk for COVID-19. In general, those are people over the age of 60 and people with chronic medical conditions. It appears that they have learned to isolate themselves, or maybe I should say they and the people who care for them have learned how to isolate the medically vulnerable. One third of cases are asymptomatic. This is why COVID-19 is so difficult. The WHO, the World Health Organization, right now is using numbers more like 5% might be asymptomatic. We're not quite sure if it happens in an asymptomatic way. They must be looking at a different virus than we have in our region, because here there's a massive percentage that are asymptomatic. The virus is where people live, and I'm going to show you it's broadly spread throughout our communities. Our Hispanic neighbors are shouldering a disproportionate share, but this seems to be improving, and I'm going to show that to you also. And then importantly, there is a storm brewing on the horizon. All right, so this is a graph, and all of these graphs I pulled this morning off the State Department of Health website. Any of you can go there at any time and find this. This is not data unique to me. This is looking at all of Washington State. And you can see the graph starts in March and it goes through the present. And what we're looking at is what I call the key metric right now. It's the rate of newly diagnosed cases per 100,000 people. So obviously in a city as big as Seattle, we expect to see more cases than in a city like Wenatchee. And in Wenatchee, we expect to see more cases than Chelan, just because of the population base. So you can see here very nicely that we are now in the second wave. We now have an incidence across the state as high as it was in April and late March. So if we zoom in on these curves a little bit, this is Chelan County. And you can see I've added in there this phase 1.9 marker. That was June 10th, when the John Weisman, who's the Secretary of Health for our state, gave us the green light to start reopening the economy. And what you can see is that in the few weeks prior to that, things had been looking better. We were very clearly on an improving slope. And that dashed orange line there is the 25 per 100,000 per 14 days, which is what the state wants us to see. And so we applied and got approval, and things continued to go down, and then they started to swing back up. And you have to remember, it takes 2 or 3 weeks to see an impact, because there's about a 5 to 10 day incubation period. And then you need to start showing symptoms to the point where you take yourself and get tested, and then you need the test results to come back. So it tends to be 2 or 3 weeks from the time that you actually contract the virus to the time you become apparent to the data here. And this is what we expected. If you think about shutting down the economy, what we really did was we gave people no reason to leave their homes. If there's no reason to leave your home, if you're an essential worker, you go to work, you go home. And if you're a non-essential worker, you stay home. But basically, people are not out commingling much. So opening up the economy also happened right about the same time that the weather started warming up and people started getting out to the parks more. So really, mobility and intermingling increased when around June 10th, and you can see that marker there, that phase 1.9. So you can see things have swung back up. The very far right side of this graph, you'll see it's grayed out, and that's the information they have so far that isn't quite complete from the last few days. So that always has that little swoop down at the end, and don't get enthusiastic about that because that is an aberration of the testing data. All right, this is now Douglas County. And even though you can see the shape of the curve is a little bit different, what I'll tell you is that weird, very steep upswing there in mid-April was the all the testing that happened at the Stamilt housing site, where we had, I forget what it was, 60-ish positives in a weekend. And because it's a 2-week cumulative run here, it's over 14 days, you can see that high number took a couple weeks to sort of go away. Anyway, the curve is roughly the same, and you can see the same thing has happened in Douglas County when we reopened the economy. Things have now swung back up. So the incidence right now in our 2 counties is about as bad as it has ever been, or as high as it has ever been. And here's the really bad news. About 15 minutes prior to jumping on this Zoom chat, I heard that Columbia Valley Community Health alone yesterday, on Monday, had 23 positives. We usually get 2 to 4 a day. We had 23. So we're on the upswing here. This is a tabular view of the same thing. What I'm calling the key metric, and at the bottom in the red type there, you can see right now, this is from yesterday, we are at 104, 103.6, 104 cases per 100,000 per 14 days in our 2 counties. Remember, the state would like to see us at 25. We got down to 25, and then we bumped back up, and now we're all the way back up to 100, 104. This now is looking at the age distribution. And these are the number of cases in our 2 counties and the age brackets in which they are. And what's pretty obvious when you look at it is that essentially all of this illness is being carried by people in the 20 to 60-year-old age group. 75%. Now you think about that age group, that's the age group that is mobile in our community. They're the folks who are going to work, they're the folks who drive out to Safeway to buy their groceries, they're the folks who are intermingling and meeting people. So the good news is that the medically frail and vulnerable, who seem to be over the age of 60, have had a low incidence. So they are insulating themselves. And as I mentioned before, these age groups that are in the 75% circle there, when in general, when they get COVID-19, it is like a bad flu. It does not put them in the hospital. And then this is, I made a comment that we're getting smarter and that the medically vulnerable are insulating themselves. This graph is a regional graph now. It's bigger than just our 2 counties because you need more data to sort of make it look pretty like this. The bars are the total number of cases, and the colored parts are the people who got really sick. So the red are people who have died, and the orange are people in the ICU, and the yellow are people who ended up in the hospital. And I hope what your eye will show you is that most of the bad illnesses and the deaths happened in the first couple months that we knew about COVID-19. And you'll see that even though the total numbers, the height of the bar has gone up dramatically over time, if you look at the June 24 bar there at the far right, it's at least twice as high as the March 11th bar, but we have nobody in the hospital. We have nobody in the ICU. So like I said, in our counties, we have done a good job insulating the medically vulnerable, which is reassuring and hopefully will allow us to reopen our economy without endangering people's lives. And then this is this symptomatic, asymptomatic thing I was telling you about. These, of the total number of cases we have tested in Chelan and Douglas County, the blue are the people who had symptoms at the time they were tested, and the orange are the people who are asymptomatic. That means, no, I don't have a headache, no, I don't have a sore throat, no, I don't feel tired. So I don't know how many people listening to me right now don't have a headache, don't have a fever, don't feel tired. Every single one of us could have COVID-19 right now and not know about it. And that, again, is why this pandemic and this virus is so incredibly difficult. It is my belief that most of the infection is happening from people who have no symptoms at all and are going out and wandering around town because they know they're fine and they're not going to infect anybody. I am quite confident that the people who are sick are actually staying home. I'll bet 99% of the people who know they're sick are staying home. So it's the asymptomatic carriage which is the problem. I said that COVID is everywhere that people are. This is a graph looking at all of our communities. The yellow curve is Wenatchee, the green curve is East Wenatchee, and all this other area down here are all the other towns. So we can zoom in on that, and you can see the gray curve is Chelan, and you can see each town has had 1, 2, 3, 5. Sorry, that's my phone ringing. How do I get rid of that? There we go. So what I don't want people to think is, gosh, it's just in the cities. It's everywhere. It's everywhere that people are. This now is a somewhat busy chart that I want to talk you through because we get lots and lots of questions about this. And this is looking at ethnicity and also looking at the industry in which people work. And what I need to point out is that just because someone works in healthcare does not mean they contracted their infection while at work. I can tell you that where I work at Columbia Valley Community Health, we have had 4 employees turn positive, and none of them contracted it at work. We know that all of them contracted it in the community. I heard Wes Matheson yesterday saying they've had, I forget how many, 100 cases, and also, as far as they're aware, only a very, very small percentage of those, like maybe less than a dozen, I think he said 6, were contracted at work. So when you look at this graph on the far left, it says agriculture, and in that bar, the blue are Hispanic workers, and the orange are non-Hispanic workers working in the agricultural industry. You can see that by far and away, the majority of cases have been in agriculture, but also that is the largest industry in our 2 counties. So that also makes sense. And so you can see the second one there is education and childcare. The third is healthcare. The next is retail and restaurants, other, unemployed or retired, and then no occupation listed. So you can see also that there's a fair amount in people who are unemployed and retired. This now is looking at Chelan County on the left and Douglas County on the right. This is looking at ages and ethnicity. The dark bar, the dark portion of the bar are Hispanic. The gray portion of the bar are non-Hispanic. And again, throughout essentially all age groups, you can see that Hispanics are shouldering a disproportionate burden of the illness. Remember, in our region, or our 2 counties, about 70% of the population are Anglo and about 30% are Hispanic. And so if it was proportionate, each of the bars should be 2/3 gray and 1/3 black. And you can see that's not the case. I'll also draw your eye, though, to the far right. You'll see that as the age increases, there's a larger and larger portion of non-Hispanic folks. And in fact, at the age of 80 and above, essentially everybody has been non-Hispanic who has contracted the virus. And then this is an interesting graph, which is trying to show how the percentage of Hispanic folks has changed over time. And so this is the amount of testing that was conducted in a week, and the percentage of that testing, I'm sorry, that's not true. It's the number of positives in a week and the percentage of those positives that were Hispanic or non-Hispanic. The blue bar is at that 30%. And so the blue bar represents about the percentage of Hispanics in our community. So again, you can see huge disparity and huge burden in the Hispanic community. However, you can see that since about May 20th, it looks like things are beginning to improve. And that for whatever reason, the interventions that have been taken hopefully are helping, and the Hispanics are no longer as heavily burdened as they have been. And then this is sort of the final slide, and the caption of this is that there's a storm brewing. Hopefully you all know where Chelan and Douglas counties are. We're in the center of Washington State, just below Okanogan County, which is gray. And when I looked at this graph yesterday or the day before, in fact, both Chelan and Douglas counties were that salmon color, and now Douglas County has turned brown. This is looking at where the disease is right now in Washington State. And you're probably aware that Yakima is on fire. Remember, I told you that we have about 104 cases per 100,000 population. In Yakima County, it's above 1,000. So Yakima has 10 times as many positives as we have. Benton Franklin, then up into Grant County, and now into Douglas County. It's just creeping this way. So there's a storm on the horizon, and as we're thinking about what we're doing now, we have to recognize that it's about to get worse because the hurricane is out in the Gulf and it's spinning towards us. So again, takeaways from the data: we are already in the second wave. Reopening the economy has increased the incidence, but not the morbidity. Most of the disease is in young people who tolerate it well. The medically vulnerable have learned to isolate themselves. Fully 1/3 of cases are asymptomatic. The virus is spread out throughout our communities. Our Hispanic neighbors are shouldering a disproportionate share, but that seems to be getting better, and there's a storm brewing on the horizon. So then a couple of other hot topics I'm happy to talk about. Masking is the next best thing to a vaccine. There is now no question. This is new information over the last 3 weeks. Masking is what's going to get us back to normal. Most of the spread is happening in groups. It's happening in Memorial Day picnics and graduation ceremonies and quinceañeras and birthday parties. It's when people jump in a car and drive from Yakima to Wenatchee and spend 2 hours breathing each other's air that the infection is being spread. The good news is we did what we wanted to. We flattened out the curve. We're in the second wave now, but we have enough testing and enough PPE and enough ventilators. The healthcare system is now prepared to treat COVID-19. And the next phase, which I know many people have questions about, we really are not eligible until we have plateaued. And as the health officer, I have recommended that if we are at or below 100 per 100,000, I think we can move forward. So that's the end of my presentation, and I'm happy now to take some questions.
Thank you, Dr. Butler. And if you want to end your screen share, I think your picture will come up larger so people can see your reactions. I really appreciate the information that you shared with us today. Can you tell us a little bit more about the Chelan-Douglas Health District and their role in dealing with COVID-19 in our communities?
Yeah. So when I arrived in Wenatchee in 1993, the health district was probably 5 times as big as it is now. They had a whole division that went out and helped pregnant mothers with their newborn babies, and they had a whole team that tracked down tuberculosis cases. During the AIDS epidemic, when there was a lot of tuberculosis, they had their own physician who was helping with tuberculosis and x-rays. They had an x-ray facility. Right now, the health district, I believe, has about 30 staff. They have teams of epidemiologists and nurses and community health workers. And their job up until COVID-19 was tracking things like rabies and HIV and syphilis, and then providing permits to restaurants and swimming pools and septic systems, the kind of things that, you know, keep us healthy. They did some contact tracing. So if somebody had tuberculosis, they would reach out and find the contacts and chase down those folks and get them tested and treated as necessary. So this COVID-19 pandemic has completely overwhelmed the resources of those 30 people. If you can even imagine, my clinic has roughly 300 employees. I think Confluence Health is sort of 10 times that big. And our clinics are completely overwhelmed. So imagine what a team of 30 people who's supposed to be doing everything people expect the health district to do can do. It's a ridiculous design, which has grown out of the fact that we haven't had a pandemic for 100 years. So I am the health officer. I do have statutory authority. That in theory, the governance structure is such that there is a board of health, which is elected officials. And then the health officer has to make a recommendation to that board, and then the board moves on that recommendation. But without a recommendation from the health officer, the board actually cannot take action. I guess they can replace the health officer. And so, of course, what we do is we gather the best data we can. We discuss it amongst the epidemiologists, the nurses, the community health workers. Then I make a recommendation to the board listens, asks good questions, and then they make a decision as to what they want to do.
My next question was going to be, does the health district have adequate staffing? It sounds like you're overwhelmed at this time. What can the community do to support the health district and to help advocate for adequate staffing?
Yeah, the adequate staffing part probably will never happen. I think the National Guard has been called out, and they've been helping in Yakima. The State Department of Health is doing a lot. For example, they're doing all of our contact tracing right now. What the community has already done is enormous. What the long-term care facilities, the nursing homes, the assisted living facilities, what they have done to keep the elderly and medically frail in our community safe is heroic. The agricultural industry has done a huge amount. They have deployed everything we've asked them to. Wes Matheson and Stamilt has taken a leadership position and shown people how this can be done. The PUD has helped us a lot, providing expertise and staff and helping writing the proposals. So the community has really rallied around us and is helping us. I would say if any of you are interested in helping, you could certainly email us and we'll let you know if we have any need. We were using a lot of community volunteers in our contact tracing, but now that's been handed over to the state. So I would say thank you already for the many people who have helped us. And if you have a strong desire to help, please contact the health district. And I have to tell you, I don't know exactly who you should contact. So I would just go on the website and ask if you can help.
We can look up the info email address or the generic email address and share that in comments, both on Facebook and on Zoom. So we're able to share that information. One of the things I think that we're finding is that we're hearing a lot of conflicting information shared on the virus. How do you recommend viewers stay up to date with local public health communications aside from monitoring the news?
Yeah, so there are several issues around that. It is a normal aspect of science that our knowledge base improves and improves over time. When I first started into medicine, ear infections were a catastrophe. Everybody had to be treated with antibiotics, and I had to see them back 7 days later to make sure they weren't going to go deaf. Exactly the same infection today is often not treated with antibiotics, and I never see them back because we now have better information. We know that medicine was not as it appeared 25 years ago. And it's the same with COVID-19. I think just looking at that graph and seeing how many people were very sick in March and April who are not sick now, we've learned stuff as we go. So it feels like there's changing and conflicting information over time. And at least a portion of that is because we're getting smarter and smarter. And the big deal right now is that 80% of transmission is happening through the air. This we did not know a month ago. But now we do. And this is why you're now hearing everybody pulling their hair out over masking, because finally we understand the importance of masking. Where should you go? Again, I would say reputable news outlets, but more importantly, the Chelan-Douglas Health District website does have data. I get most of my data from the Washington State Department of Health website and their graphs. They are working very closely with the University of Washington and their School of Public Health, and they have excellent data. And then when I have other questions, I go to the CDC, and the cdc.gov website also has excellent data. So I would say that the State Department of Health and the CDC are probably the most robust data sources right now.
Thank you. We're hearing a lot of comparisons to seasonal flu, and some people saying we don't panic every year over the flu. Why are we panicking over this? Can you talk about how coronavirus is similar or different from influenza?
Yeah, so that's a great question, and I'm going to rephrase it a little differently that I've heard. I've heard people say, hey, listen, 5% of the people are getting sick with this, but 95 of us are suffering, so why? And so to frame it for you, we've been doing this now for 2 or 3 months, right? As many people in this country have died as died in the first 2 years of World War II. And by this time next year, by the time the virus is ready, we will probably have exceeded the number of people who died in World War II. So that the seasonal flu is dangerous for people who are medically frail, and therefore we vaccinate everybody. And we develop a herd immunity because more than half the population gets vaccinated. So if somebody gets the flu, it's very hard to transmit it. So if, for example, half of a classroom has been vaccinated and a kid walks in with the flu, they would have to cough on the wrong half of the classroom, if you will, to spread it to anybody. If there's the highest chance that they won't spread it to anybody at all because so many people have been vaccinated. And so the seasonal flu, we have a medicine called Tamiflu that we can treat it with. We have vaccinations that we can protect people. And the healthcare system was designed and sized appropriately to manage seasonal flu when it comes through. This is completely different. Now, from the virus's standpoint, in influenza, the vast majority of people have symptoms. I think it's like 10% of people in influenza do not have symptoms. 30% of people, 33% of people are asymptomatic with COVID-19. And as I mentioned before, that means that if you stay home when you feel sick, you'll still be wrong a third of the time. And that's just not the same in the flu. The other thing is COVID-19 looks to be overall probably at least 10 times as infectious as influenza. So it's got all these things going for it. It's contagious when you don't know. It's incredibly virulent and contagious. It takes 5 to 10 days to start showing symptoms. So again, there's this long period where you're asymptomatic. So it is almost the perfect pandemic type of virus, and it is much more dangerous than influenza. When those comments were first being made, gosh, look, hardly anybody's died from this, and look at all the people who died from influenza, that was a couple of months ago. If you look now at the number of people who have died relative to those who die every year, and then you wait and see what it's going to be like a year from now by the time the virus comes out, this is way, way, way worse.
Thank you for sharing that background. Can you tell us a little bit more about the governor's phased plan for reopening Washington? What phase we're in, how we can support efforts to move to the next phase?
Yeah, so most of you have probably heard about this. The governor, and of course it wasn't the governor, it was his Secretary of Health and all of their Department of Health. But they came out and in essence tried to make a regional approach so that each county could reopen their economies as was fitting for their individual situation. They have never been through this before, any of them. They didn't have good information. They did the best that they could. They made, at the time, what appeared to me to be very solid guesses and decisions. And over time now, we know more and more and more. What we know now, for example, is that COVID-19 in Eastern Washington looks very different than in Western Washington. I don't know exactly why. I don't know if that's urban versus rural, or cold versus hot, or agricultural versus non-agricultural, but it's different, and the way it moves through communities is different. So we're at a point now where one size no longer fits all, and I think it makes more sense to tailor things individually. And I know the Department of Health has been willing to do that, which is why, even though Chelan and Douglas counties did not qualify based on the governor's phased approach to move into phase 2, we put together a proposal and it was accepted. And so we're calling that phase 1.9. The next move to phase, for us, 2, and for many people, phase 3, everybody was just expecting things will go well and we'll move forward. They were not anticipating the second wave was going to hit right now. And as I've mentioned, we are now in the second wave, and I honestly think from the state's perspective, that's going to put everything on hold. It just does not make sense to continue opening the economy when we know that the spread is, when it's really hot. And although in our county, our healthcare system is doing fine, that is not true in Yakima County. They are shipping people out of the county every single day to get healthcare because their hospital systems are overwhelmed. So I think we need to slow it down. I think we've got the economy open a lot, obviously not 100%. The other thing that happens whenever we open the economy is people think, oh, good, we can relax, it's getting better, we can, not be quite as careful about washing our hands and not meeting in groups and touching our face and everything else. And that, unfortunately, is wrong. And that's why these numbers are going up. But again, right now, the disease is in young people, and the young people are able to tolerate it well. So the critical thing from my perspective is we have to be able to insulate the medically frail and vulnerable. The problem is you may have a 25-year-old who goes to a party and is infected and is fine with it. It doesn't make them very sick, but they are taking care of their grandmother, or they're taking care of their brother with leukemia, or they work at a nursing home, and that's where the badness happens. So for now, at least based on the numbers I saw yesterday, we are not ready to move into the next phase. We do have a team working on that, and as soon as the numbers start to flatten off again, we can move forward. The question is, what can we do to help? We need to wear our masks. Masks will shut down 80% of the transmission. Masks are the thing that are going to allow us to reopen our businesses. As long as the medically vulnerable stay home, and as long as everybody else is wearing a mask, we should be able to get back to normal.
Dr. Butler, you recently wrote an article that was published as an opinion piece in the Wenatchee World. People are responding really well to the information that you shared. Can you tell us a little bit about that article?
Yeah, it was actually a review of my personal journey. I started off like all other physicians. I've gained a whole bunch more knowledge, and now it's obvious to me why masking is so important. And the reason why is that this virus is mostly spread in droplets. And if you think of droplets like soap bubbles, maybe you play with bubbles out in your yard with your kids, the big bubbles are going to float around for a little while and then they're going to settle down to the ground. But very small bubbles will float around all day. In fact, you'll lose sight of them because they'll shoot up into the sky. Well, droplets are the same. But big droplets are filled with a whole lot of virus, and small droplets don't have very much at all. So it turns out that the big droplets are very contagious, and the small droplets are not very contagious. I've heard people say, well, masks aren't any good because the small droplets can get through them. And that is true, but it kind of doesn't matter because those small droplets are not very contagious. And then there are middle-sized droplets. And the cool thing, I think it's cool, is that these middle-sized droplets, you cough them out, but they're just the right size so that the water starts evaporating out of them fast enough that they turn into small droplets, and then they can float around all day. But remember, they had a medium volume of virus inside of them. So now you've got these little droplets full of virus that can float around all day. And those are the ones I think that are the super infectors and getting people into trouble. So when you wear a mask, and remember, most of us on this phone call who feel fine right now could be infectious. So when I feel fine and I wear a mask, it traps those large droplets and the medium-sized droplets so that the only virus that can escape are in those tiny little droplets that aren't very infectious. The other thing that's important for people to understand is it doesn't take one virus being inhaled through your nose to infect you. It probably takes 1,000. And of those 1,000, 1 or 2 are going to land on the appropriate virus receptor, which will transport them into your bloodstream. So it's actually about the air that we share. It's about how long we inhale the air of somebody who is infected and how long it takes us to inhale 1,000 viruses. And that defines when we become infected. So again, outside we should be safe. Inside, like at a birthday party or in a car, that's a dangerous spot. So being outside, staying apart, wearing a mask, those are the things that are going to shut down the infection.
You've talked a little bit about this, but we received a lot of questions about it. So I'm hoping you can reiterate. Many of us remember that at the beginning of this pandemic, we were told that masks weren't required. Right. And then later the CDC said that they were necessary. Can you talk a little bit about the evolution of that recommendation? Yeah.
And it harkens back to what I mentioned a little while ago about the evolution of our understanding of this infection. But I will freely admit, I was early on telling people masks are stupid, don't bother wearing a mask, and I was wrong. I wish I knew back in March what I know now. And that's because healthcare providers are trained in the use of masks while you're taking care of sick people in a hospital or when you're doing a surgery in a hospital. So if I'm working in a hospital taking care of somebody with tuberculosis, I put on a gown and a mask and gloves when I walk into that patient's room because I want to protect myself from that patient. And when I leave that patient's room, before I walk out, I take off my mask, I take off my gown, I take off my gloves, I throw them all in the trash. I then go outside, wash my hands before I walk into the next room. And I do all of that so that I don't spread the virus to the next person. So our medical professionals' understanding of how we use medical grade masks is 180 degrees different from what we're using them for now. But remember, no part of the way I was trained to use a mask was about trapping large and medium-sized droplets to prevent me in an asymptomatic state infecting other people. It's apples and oranges. And so it is the same tool that we're using, a mask, or now face coverings, for a different job. And I know that's incredibly confusing, and anybody who wants to say they don't know what they're doing, they're making this up, they're not the boss of me, I'm not going to do what they tell me because they don't know what they're talking about, please understand the nature of science. We now have a different mental model of how COVID-19 works. We are now deploying an old-fashioned tool in the form of masking for a new reason, which is to capture these viruses and to constrain the infection into the person who's infected and not let it float out around in the environment and infect other people.
What types of masks do you recommend? Are disposable or cloth masks equally as effective or recommended?
Yeah, so that's a difficult and delicate question. And so I'm going to give you Dr. Butler's opinion, which does not necessarily echo the opinion of the State Department of Health. My opinion is you should wear the highest grade mask you can. And for a long time, we didn't even have enough masks for the people taking care of the COVID patients. You know, if you know that everybody you're working with all day long is infectious, you really want good masking. And so we had to preserve the professional grade masks. That's not the case anymore. Today, at the beginning of the second wave, we have plenty of PPE for most healthcare providers. Masks, the N95 masks come in various sizes, and the size small and sort of extra small, we don't have enough. But for most people, we do. So it's my opinion, if you can get your hands on medical grade masking, go for it. Now, the Secretary of Health said something different. He said, do not wear medical masks. Leave those for the first responders, the folks who are working in nursing homes, and healthcare providers. And I think that's a reasonable argument. As far as we can tell, N95s are the best, surgical masks are next, and any type of face covering comes after that. So yes, they are effective. Yes, they capture the large drops and probably most of the medium-sized drops, but they're not as effective as a professional grade mask. So at my clinic, when you come in for a visit, we hand you a mask. Take it home and wear it for a few days. The difference is, though, they get worn out, and they get clogged up, and they're hard to breathe through over time, so you got to throw them away. You cannot wash them. There are ways to reuse to sterilize and reclean them, but don't think about that stuff. The cloth disposable face covering, the cloth washable face covering is great because you get 3 of them and you wear one, and that night you wash it, you put on a fresh one, you wash that, put on another one. So I think for all of us as we're moving around town, face or cloth coverings make very good sense. And if you can get your hands on professional grade masks, don't be afraid to wear them, even though that has come out in some guidance.
We've heard that mask wearing isn't really a law, although it's a mandate or a recommendation. There's no RCW. Can the health district or businesses require us to wear a mask? And what about ADA compliance?
Yeah, that's interesting. So again, I think if people are looking for reasons not to help their neighbor, you can come up probably with a whole lot of reasons not to do that. When I was in elementary school, I learned to put my hand over my heart and recite the Pledge of Allegiance. We all did it because we were citizens and it was a civic duty. Singing the national anthem, civic duty. You don't have to. Nobody's going to arrest you if you don't say the Pledge of Allegiance or sing the national anthem. But it's a civic duty. We all do it, and it's how we feel like we're citizens. The analogy I would make a little bit is like smoking in restaurants. Smoking in restaurants is not allowed, and it was allowed up until about 10 years ago, probably. And then the evidence that secondhand smoke causes cancer and heart disease became incontrovertible. We just knew that it was dangerous to be around people who smoke. And at that point, a public health measure was deployed, which made it, which restricted your capacity to smoke in a restaurant. And businesses have to enforce that. And if they don't enforce that, then labor and industries can come and pull their license. And this is pretty much the same thing. So even though it is a mandate and it is potentially a misdemeanor, the governor himself has said it's really not enforceable and that the governor doesn't expect law enforcement to be enforcing this. And I promise you, nobody has given Dr. Butler a badge to go out in the park and enforce this. That's not what it's about. It's about educating people as to the why. Why do we not smoke in restaurants? It's to protect the people around us. What about speed limits? Why do you not drive 100 miles an hour all the way to Seattle? Well, people say, well, because there's a speed limit, it's a law, I could get a ticket. And I get that, but there isn't a cop everywhere. So why don't you drive 80 miles an hour? And the answer is, well, because it's dangerous. And although I'm safe driving 80 miles an hour, that idiot coming the other direction might not be, and he might kill me. And people understand that a speed limit is there to keep everybody safe. And it's basically the same thing. Masks are there to keep everybody safe. So is it an ADA thing? We have a bunch of people coming in all the time saying, I need a doctor's note saying that I shouldn't have to wear a mask. Listen, if you have some kind of an infection or a chronic illness and it's difficult for you to wear a mask, don't wear a mask. Stay home. Just don't go around where you might breathe on other people or they may inhale your air and might catch the infection should you happen to have it. But if you're lucky enough not to be like that, if you can tolerate a mask, then you can leave your home and you can go out and participate in the community and nobody's going to be endangered if you happen to be asymptomatic and infected. So I would say don't look for excuses not to wear a mask. Do it because it's the right thing to do. And if you're uncomfortable doing it, don't go out around other people.
Thank you. I'd like to move on to contact tracing and testing. What do we do if we're sick, and where do we go for tests in Chelan and Douglas counties?
Yeah, great question. So initially the guidance was if you are sick, stay home. And now the guidance, I think, is if you're sick, get tested. In Chelan and Douglas counties, Confluence Health has a drive-through, and if you get your primary care through Confluence Health, you can contact them, ask them if you can get tested. It does require an order, so a medical provider has to put in an order for that. So you would contact your provider and they would test you. You can come into Columbia Valley Community Health or call us if your primary care provider is here. Same thing, we can arrange for you to be tested. If you don't have a primary care provider, you could come into, I know the emergency departments at Lake Chelan and, well, that may not be true, but at Cascade in Leavenworth and Central Washington Hospital, and certainly at Columbia Valley Community Health, our Express Care are all seeing walk-in patients for testing. So at all those sites, we can do it. Up in Chelan, I believe both Lake Chelan Community Hospital and Columbia Valley Community Health are doing it at the Columbia Valley Community Health Clinic up there. So basically, call your provider and ask if you can be tested.
Should we get tested anytime we have symptoms of anything? We're seeing that there's a wide range of symptoms here, or before a trip or before visiting relatives or at risk. When do we get tested?
Yeah, that's a good question. So the guidance right now would be, if you know that you have potentially been exposed, you can get tested. So if you are contacted by a contact tracer and say, hey, I got some news for you, you were at an event 2 days ago and you might have been exposed, all you need to do is tell a provider that you were exposed and you can get tested. If you have fever or if you have shortness of breath, you can get tested. And then if you have any number of other symptoms, cough, loss of smell, essentially headache, runny nose, malaise, feeling bad, nausea, any of that stuff, if you have at least 2 of those, you can get tested. If you have been in any group settings, so if you went to a quinceañera, if you were at a Memorial Day barbecue, if you were at a birthday party, and you develop symptoms a few days later, all you need to say is, listen, I was at a group event and now I'm feeling sick, I'd like to be tested, and we will test you. The question of, gosh, I'm traveling to Oregon to take care of my mother who's elderly, could I get tested, please, is a little bit more difficult, and I would recommend that you talk to your primary care provider about that. Any of my patients who came to me with that story, I would say, yes, absolutely, that's fine, and I'd order the test. I can tell you that right now we have plenty of testing capacity to do that. So I believe that most providers right now would test you, but it is complex and we'd want to talk through what does it mean, should you wear a mask, should you self-quarantine, and all the other questions that come up. We have a lot of people who work in the fishing industry in Alaska, and Alaska right now is requiring a 2-week quarantine period. So we'd like to be able to talk people through that also.
Can you tell us a little bit more about the contact tracing that you've mentioned? We've been seeing a lot about that in the news. Who's leading that effort? How does that work?
Yeah, so contact tracing, again, very old. You can imagine somebody with tuberculosis, they were waiting maybe, they went to the library and were in the library for an hour coughing. We realize they're positive, and then a public health nurse goes out and finds everybody else who was in the library around the time that that infected patient was coughing in the library. That nurse would then call people and say, we've got some bad news, you've been exposed, we'd like you to come and get tested. So it's exactly the same thing. The difference is we're doing it on a very large scale now because we have so many people who are positive. But in essence, anybody who's positive will get a phone call. And the goal is to try and identify from whom you may have contracted it and to whom you may have passed it. And then once the contact tracer gets that list of names, we're going to call all those people too. And we're going to give them information. If you'd like to get tested, here's where you can do it. If you develop symptoms, please stay home. And they're going to recommend that everybody who's been a contact stay home for at least 14 days. We call that quarantine. Now, a contact is somebody who has been within 6 feet for at least 15 minutes. So remember I said it's the air that you share. You need to have inhaled a certain amount of virus in order to have become infected. So just talking with somebody who was infected for 2 minutes in the grocery store is not enough time. It really is 15 minutes within 6 feet. And so if that's the case, you'll get a phone call, you'll be given some education, and that's the end of it. While you are in quarantine, you should get a phone call every day, and a nurse is going to call and check on you and see how you're doing. And if you're feeling sick, give you some advice. And then, of course, there are people who don't have adequate places to stay while they're sick. They may not have a home, or they may be living with people who are medically frail, and they may not have the financial means to go and check into a hotel room or something. So we also do have a quarantine and isolation facility available for folks who need to quarantine but don't have a safe place to do that. And the contact tracers would help you get into that facility also.
Do we hope to get to a place where we're able to test everyone in our community?
No, that's just impossible. So, and here's the reason why. Let's say we tested 60,000 people in Wenatchee today. Well, by Saturday, they could all have contracted the disease and be positive. So you essentially have to be testing everybody in the community every 3 to 5 days. And, you know, the numbers are just astronomical. Plus, remember, each test costs about $100. So we are next week going to be doing some prevalence testing where we've selected random homes in our region, and they will be getting a letter saying, hey, would you participate in this random testing event? And if so, here's the place where you can come and get tested. But outside of that, the goal is not to test everybody, but it's to test people who have been in dangerous situations. So they've been in group settings or they have been exposed. The other place we're doing it is congregate settings, we call them. So let's say you work in a packing facility where you cannot be 6 feet apart. In those facilities, if 1 or 2 people turn positive, then we're going to test the entire facility. Same in a nursing home. If 1 or 2 people turn positive, we're going to test the entire facility.
And is that where we're getting the information on asymptomatic cases? I've heard you talking about that, but I haven't seen much about that in the news.
Right, and so that's correct. If somebody turns positive and it turns out they have been within 6 feet of 10 different people for 15 minutes, we're going to call all 10 of those people and ask them to come in and get tested, whether they're symptomatic or not symptomatic. And it's those contacts who are not symptomatic who we're asking to come in and get tested. Those are the folks who are showing us what percentage of the population is asymptomatic and still contagious. And we know they're contagious because if they have enough virus in their nose to turn the test positive, they have enough to spread around. There are some complexities around testing also, and some people, the tests don't turn negative for like months, and that's a longer discussion.
True. For a while, we were hearing a lot about antibody tests. Should we get them, and are they available here?
Yeah. So no and yes. So antibody testing is available. I have in the past described it as a garbage test. It is no longer a garbage test, but it is now a test looking for a reason to exist. You can come in and I can test your blood and I can tell you that you were at some time in the past exposed to COVID-19. I cannot tell you if you are immune. I cannot tell you that you don't need to wear a mask anymore. I cannot tell you that even if you are immune, how long will that last? Basically, the only thing I can do is confirm that at some point in the past you were exposed. And so there's a very small portion of the population where that's medically important to know. It is not a good way to test people to see if they're infected now. And we can't use it to say, oh, you're safe to go back and work in that nursing home because you can no longer be infectious. We don't know that that's true.
I'm looking at the time. I want to respect our participants, and Dr. Butler, I want to respect your time. I have a couple last questions, and then I'll invite you to say a few last words if you'd like. We've heard a lot about flattening the curve, and you talked today about how we're in the second wave. Do we anticipate that do we have a date that we anticipate might be the peak of that second wave?
No, I don't have a date for the peak of the second wave. I don't know if the second wave is going to be bigger than the first, although today, this morning, it looks like it could be. So I think we're going to come and go in and out of these waves over time. A lot of people get sick. Everybody takes it seriously. It goes down. People are feeling better. They start intermingling. It goes back up. I think it's going to be that way for another year.
And toward next steps, I feel like the number one question we're seeing from people is, when can we start expanding our social circles? When can things go more back to normal? And specifically, I was wondering if you can speak to what you anticipate schools might be in the fall. Does the health district have any role in determining whether or not the schools can reopen?
The health district does have a role, and I'll say right now, it is too early to know. Guidance came out this week from OSPI, sort of with their recommendations. And again, as your health officer, the issue is that school-age children, even if they do get sick, do fine with the infection. We're not worried about the school-age children. We're worried about who they might take it home to and spread it to. And we're also worried about teachers who are in a high-risk group. If I could magically move all of the medically frail people to New Zealand, we could have all the in-class education we need. Because again, kids passing it to other kids are going to tolerate it just like influenza, not a big deal. But I can't do that. So my hope is that by the time we have to reopen schools, we have better ideas on how to isolate the medically vulnerable so that we can get kids back to school. It is clear to everybody that the best way to educate our kids is in schools. We just are not quite sure yet how to do that and still protect those who could die if they contract COVID-19.
And I see that we've moved to 1, so we're through our hour. Are there any last thoughts you'd like to share with our participants today?
Yeah, I appreciate the time people have taken. I'm probably preaching to the choir for the folks who take the time to listen to this kind of a presentation. Masking is the next best thing to the vaccine. Even if the vaccine comes out in December, January, which is optimistic, we will not have enough vaccine to vaccinate the people listening to me now until next June. We are at least a year away from vaccination. As far as I can tell today, wearing a mask is about as powerful as getting vaccinated. If you wear your mask, you can get out right now into the economy and do anything you need to do. If you are unwilling or unable to wear a mask, please don't go out into the community because you could spread the infection, and then we're going to have to shut down the economy again, and that's going to be a disaster for all of us. And thank you all for your time.
Thank you, Dr. Butler, and thank you to our participants for joining us for this public health Q&A with the museum. I recognize that a lot of these issues have been polarizing for our community, especially as it relates to our local businesses, our economy, and our ever-changing and updating information as we learn new things about this virus. We've all seen conflicting messages on public safety and on masking and on how the virus spreads and on public health. And I know it's been difficult for us. We appreciate at the museum this opportunity to support public health efforts in our region and the opportunity for us as a community to learn about accurate public health information directly from our local health expert. So to our participants, I want to thank you for your constructive and productive questions. To our panelists, Dr. Butler, I thank you for your participation and the expertise you've lent this conversation today. I sincerely appreciate your time and the opportunity to learn from you about your work. The museum will be hosting upcoming sessions, as I mentioned, with the public school district, with local superintendents, what that will look like in the fall, and the continuation of our social justice series. Thank you all for joining us today, and Dr. Butler, thanks for your time.